the SA Medical Association Vice Chair, I'm sure you know his name by now, Mvuyisi Mzukwa, says the severity of this third wave could actually have been avoided. He says government simply ignored the advice of some members of the Ministerial Advisory Committee on COVID-19. He joins us now to unpack this for us. Mvuyisi, good morning to you. It's a pleasure speaking to you. You and I have spoken before. We spoke about how you have politicians and you have our health experts sitting in this committee trying to find solutions. And you were actually quoted in the City Press, I spoke about it earlier as well, saying that warnings and suggestions from health experts are being ignored and government should have listened. Just tell me how bad that is. Take me into that meeting if you can. Why do you think you're being ignored?
Well, I think we are sitting here, Gareth, today, mourning the death of many patients, simply because we are not learning. I mean, this is a third wave. We should have had lessons from the first wave, the second wave. Now the third wave, we should be better prepared. But that's what we have not seen. We have not seen with this wave. There was no preparedness. I mean, looking at the utterances, for example, of Dr. Mlisana recently regarding Gauteng, clearly there are discussions that have happened there. Obviously, she cannot tell us what exactly happened, which I don't want to dwell in such, but I want to dwell on the lessons that we have learned and also what took us to the third wave and the disaster that we find ourselves in.
What was the lesson then, Mvuyisi, if you could, that we should have learned from, let's call it the first wave and the second wave, going now into this third wave, which is even getting worse and worse? What's the lesson that government and, to be fair, the public should have learned?
You will understand that most of this battle, the COVID-19 battle, happens outside of the hospital. Now it happens in the communities. So you need to intervene first in the communities. Who must do that? It is leadership of the country. The leadership of the country needs to get advice from experts. Experts, unfortunately this time, they told government that the third wave is not going to be as bad as the other waves, which was unfortunate, because what we have seen now is that there's another variant that has caused problems. And secondly, especially Gauteng did not have much of the second wave like in other provinces. So we should have known that natural immunity is down in Gauteng. It may be hit hard if the second wave, the third wave comes in. That's the first one. The second one is the issue of restrictions. Restrictions in the sense that we know by now that alcohol-related injuries, they occupy lots of beds in hospitals. So we should not shy away from shutting down those taverns and ship-ins, making sure that the gatherings also, we take down the numbers. We should have gone down to 50 at least people gathering right from the beginning when we are told that the cases are rising. The other thing, when you are inside the hospital now, you need to make sure that your free beds, especially those that were supposed to be occupied by elective surgery. Elective surgery, I mean surgery that can wait until the third wave is gone. Like, for example, if a lady comes in, you needed to have a uterus or a womb removed, that can wait until the next thing. Because after that lady will be occupying a high care bed. So all those things should have been thought.
Dr. Mzukwa, let me ask you this in the last minute I have with you. If we can go back to the meetings for a moment, where it seems that government is seemingly not listening to health experts. Help me understand, is government ignoring what is being said to your understanding, or are they arguing back against what is being said by the health experts? Last minute is yours, Doctor.
What is obvious is that the experts, when they talk, they give us an understanding that they are ignored by government. If experts were listened to, we wouldn't be where we are at the moment. That is what the understanding that we we have listening to the engagement out there in the media, including members of the MEC.